Screening saves lives. If you're eligible to be screened, you should be screened because it means that you have a higher risk of having lung cancer. And if you're screened and it's found early, you have a very good chance of doing very well with minimal treatment. Get screened.
It is World Lung Cancer Day, and LCFA, Lung Cancer Foundation of America, is flooding social media today with helpful news about lung cancer screenings and the latest in lung cancer research. Now, one topic getting a lot of attention right now is something called STK11.
It kind of sounds like steak sauce, but STK11 is actually a way to hone in on one particular form of lung cancer. Think of it this way. Our DNA, it's like a highway system. It carries information that's necessary for all of our cells to function. But what happens if that roadmap has a glitch or a typo? The cell receives the wrong signals and can grow into cancer. That's a problem.
So biomarker testing can help doctors identify those typos or glitches, and so that they can then use targeted therapy. And one of the newest types of biomarkers is called STK11.
So STK11 was the topic of a recent Lung Cancer Foundation of America Hope with Answers podcast. This one featured Dr. Salman Punekar and patient advocate Stephanie Williams. Here's a brief look at that popular podcast.
You know, STK11 is kind of a newer kid on the block in terms of a biomarker that we've been considering for lung cancer, but we do think that it's hugely important, especially because it affects the current treatments and maybe makes the current treatments that we have, such as immunotherapy, less effective. So I think going forward, our research is really going to focus on how do we reverse that? How do we make STK11 mutations not a additional worse prognostic factor for patients? And that's really what our goal is here when we do this research.
And they are finding that targeted therapy improves disease-free survival. So it reconfirmed that I'm on the right track and making the right choices. And I mean, in real time, clinical trial data is informing doctors and patients on how best to treat our unique cases.
To learn more about STK11 or anything else having to do with lung cancer, go to lcfamerica.org.
We've been showing you everyday people living with lung cancer. Our friend Frank McKenna is a non-smoker and a health-conscious personal trainer. As we've said today, anybody with lungs can get lung cancer.
And Frank has this fantastic personal motto. It's win the day. He even has it on his license plate. But he's also a tireless advocate for lung cancer research because he also wants to win tomorrow. So now we're going to see a story with Frank and his daughter from their Florida home.
Hi, I'm Frank McKenna, an 8-year survivor of stage 4 lung cancer. And I'm here with my daughter, Caitlin, who's also an 8-year survivor of cancer. And we're on vacation this weekend. We're visiting in Pittsburgh because my sister is having her 50th wedding anniversary. And we're showing you how we are living with cancer. I am living with lung cancer, and I am thriving due to the therapies and the treatments that have been discovered through funding and research. I'm working with Lung Cancer Foundation of America, which is lcfamerica.org. And we're doing these promotions for World Lung Cancer Day. And what we want to do is be able to show you how we're living with lung cancer. So today, Caitlin and I are going to teach my Zoom fitness class. It's a weekly fitness class that I run for cancer survivors. And since I had the opportunity to be with Caitlin this weekend, we're going to run the class together. That's how I'm living my best life. That's how Caitlin's living her best life. And we didn't let cancer stop us from doing the things that we want to do. So check out lcfamerica.org, and you can get our stories. You can get more information about lung cancer, donations, how the foundation works. And it's just an excellent way to give back to the community like we're about to give back to my cancer community. I hope they're ready today because Caitlin and I have a heck of a workout ready for them.